With that, we want to turn our attention to those COVID headlines. We got some extremely promising news to talk about when it comes to this COVID surge. North Carolina today seeing its lowest single-day case count in a whole month. 7,000 people testing positive for the virus, which you can see is significantly lower than what we've been seeing the past several weeks. That curve is starting to flatten when it comes to percent positivity rate as well. Over the last 2 weeks, 31.8% of tests have been detecting the virus, a high level, but as we mentioned, that is starting to decrease. Speaking of decreasing, we've also seen 4 straight days of declines in hospitalizations. Right now, 4,800 people in the hospital battling serious cases of COVID-19. So despite those numbers slowly starting to come down, we can see those levels are still high. Burke County's healthcare leaders, on that note, are asking patients to be patient. The CEO of UNC Health Blue Ridge in Morganton and Burke County's EMS director penning open letters asking for families to bear with them as they deal with crushing caseloads as a result of this pandemic. WCNC Charlotte's Brandon Golder joins us live from Morganton tonight. So, Brandon, what are the hospitalizations looking like there?
Well, Vanessa, both leaders say that they are committed to what they're doing when it comes to taking care of patients. But right now they're saying they're just dealing with a crushing load. So they're hoping that by putting these letters out there that they can be more transparent about the tough processes they're going through. As she walked the halls of UNC Health Blue Ridge, CEO Kathy Bailey noticed something alarming in her staff's faces.
We're entering our 3rd year of a pandemic that really we all thought, we'll get through it in a few months and then we'll go back to normal. And here we are, year 3. And they're tired. The patient numbers keep coming.
With more healthcare workers leaving the field and staffing vacancies piling up, patients coming to UNC Health Blue Ridge's emergency department have to wait longer.
We just have so many hands to take care of patients and so many patients to be taken care of.
She hopes her letter to the community will help patients understand her staff is doing the best they can. Burke County EMS Director Jason Black penned a similar letter on Facebook.
Some of the waits have been rather lengthy, and they get frustrated with us, and we don't really have anything to do with that.
UNC Health Blue Ridge does everything it can not to divert patients to hospitals in other counties, which can lead to long wait times in the emergency department, but it helps ambulances get back on the road quicker.
There may be somebody in the back having a stroke or the worst event in their life, and you may have to wait an hour or 2 or more. Just be patient with us.
Coming up at 6, we'll delve a little bit deeper into the diversion policy and the additional efforts that the hospital and EMS are taking to try to find more people to fill their positions. Live in Morganton, Brandon Goldner, WCNC Charlotte.
Great, we'll see you again, Brandon. Thank you.